Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Hello, everyone, and welcome to the show. We have a very special guest here today. Dr. Schulman and I are welcoming Dr. Bruce Greyson. This is where we insert all of the applause. A very special guest indeed for me. This will be a memorable interview for my lifetime, because Dr. Bruce Greyson has been a mentor of mine and has helped shape a lot of my thinking and beliefs and the way that we approach and study and understand and interpret near-death experiences. Now, Dr. Greyson, you are a professor of psychiatric medicine at the University of Virginia in Charlottesville, and have the Carlson Professor of Psychiatry and Neurobehavioral Sciences, with the former director taking over for Ian Stevenson, as we were talking just before the show, the department, now the Division of Perceptual Studies is the new name, Department of Psychiatry and Neurobehavioral Sciences, and again, work at the hospital and clinics at the University of Virginia. So again, thank you so much for your time and being in here. It is an absolute honor. I can't believe you're actually sitting virtually here in the room with us.
Thank you, Mark. I'm really delighted to be talking to you and Richard today.
Well, Rich, do you want to hit off with some questions? Because I will just queen out on this guy the whole time. I got so many questions.
Mark, enjoy yourself. I always support that. You know, I guess my first question, and I gotta admit, I have seen bunches of your videos. How does a science guy become one of the top metaphysical guys?
Well, I think the answer is by following the science. You know, I was raised as a scientist. My father was a scientist, and I assumed I was going to do that as well. But he was really a materialistic philosopher as well, and he kind of raised me with this materialistic mindset. We had no spiritual or religious background in our family. So, you know, what you see is what you get. The physical world is all there is. And when you die, that's the end of it. That's life. So I went through medical school and after college, just with that materialistic mindset, thinking you just follow the data. And when I started my psychiatric training, I started being confronted with people who claimed to have left their bodies when they were dead or near dead, and could tell me things that they shouldn't have been able to see or hear while they were unconscious or in fact pronounced dead. And it didn't make any sense to me as a materialistic scientist. So I didn't know what to make of it, but I couldn't deny that it existed. Now, that is not scientific, that's dogma. So a true scientist has to follow the data. So I started collecting other cases, and the more cases I collected, the harder it became to explain these things away with just the material world. So following the data led me to think that there's something more than just that.
How did it change you personally? I mean, I relate a lot to you in terms of the way we think and dare I say, our intellect, but no, just an evidence-based scientific background. I think you admired that about Dr. Stevenson. Yes. At how rigorous and intensive, serious of the data, you know, you just walking into the room there at DOPS and looking at the mountains of data that man collected it gives me chills. It's amazing. And I think you did a wonderful job taking over that torch. In the process, how did you change in your beliefs or the way you treat people or view society?
It was just distressing at first because it really shook up how I saw the world, how I saw myself, and what we're all about. Made me consider things that I never would have dreamt of before, like what happens after you die. Never occurred to me there's anything that happens after you just die, and it's the end of it. But it's much more than that, because as I talk to more and more near-death experiencers, they talk not only about what happens after death, but what's meaningful before death in this life. And they come back from a near-death experience with a sense of being interconnected, with a strong sense of spirituality, not religion, not any particular dogma of any denomination, but a sense of a deep spirituality, of interconnection with other people, with the natural world, with the universe, with the divine. And if you really believe that we're all interconnected, then you treat people differently. You know, we talk about the golden rule, which is a part of every religion we have here on this planet: do unto others as you'd have them do unto you. But for most of us, that's just a guideline we're supposed to follow. In the near-death experience, though, they experience that as a law of nature, that when you hurt other people, you hurt yourself. You can't avoid that. And vice versa, when you help other people, you're also helping yourself. So they come back with this appreciation that we're all in this together. Often they've talked to me something like, look, if you look at the fingers of your hand, they look like they're separate entities. But when you see the whole hand with the palm, you realize they're all interconnected, and you can't cut off one without hurting all of them. So they end up treating people as if they're a part of you and you're a part of them.
Does that last for the rest of their life?
I've been working with these same group of near-death experiences, some of them for 40 or 50 years. So I've been able to go back and see how they change over the decades. And the after effects of being more spiritual, more interconnected, more compassionate do not change at all. They stay with them forever.
Why
Are
do you
there?
think,
Oh,
why do
go
you
ahead.
think- I don't know if this is the right question. I guess, why do you think they transform is what NDEs transform? You've already kind of addressed. How do they transform?
Good question, Richard. It kind of depends on what you were like beforehand. You know, if you were a very spiritual person beforehand, it may not change you very much, but most Westerners are not. And probably the most dramatic changes I see are people who were involved in violent pursuits before the near-death experience. And that's not a value judgment. Sometimes they have jobs that require them to be violent, such as career police officers or military officers. One of the most dramatic effects I saw was in a fellow who was a self-described schoolyard bully, whose career was always his goal in life is to become a Marine and beat other people up. And he did that. He went to Vietnam as a sergeant in the Marines, and while he was there, he was shot. And there were mortar fragments all over his chest. So he was air evac'd from Vietnam to a hospital in the Philippines, where they did an operation to clean out his chest. And during that operation, his heart stopped, he coded, and he had to be resuscitated. And he had an incredible near-death experience on the operating table. And he came back with this feeling that we're all in this together. We're all part of the same thing. And after the rehab, he was sent back into the jungle and found he just could not continue doing this. He was there leading his troop and he couldn't shoot his gun. The idea of shooting someone else was just unthinkable. So he ended up leaving the Marines, which had been his lifelong goal, and coming back to the States, and he ended up retraining to be a medical technician. And that's kind of typical of things I hear. I've heard that from police officers who, after a near-death experience, couldn't continue that goal. I've also heard it in a less dramatic fashion from people who were in cutthroat businesses, where the goal is to get ahead of someone else's expense. And after a near-death experience, that no longer made sense to them. And they often changed careers, but sometimes they didn't. They just changed how they did their career. And they treated their competitors, their employees, much more compassionately. But many of them changed their careers, and they go into some helping profession, healthcare, teaching, social work, clergy, and that totally transforms their lives. Not always making it easier, though.
Right.
Often their families don't understand why this person has changed overnight. And I've seen people getting divorced. I've seen lots of problems in readjusting to quite a normal life after an NDE.
And of course, we did a whole study on divorce, right? And NDEs, because I thought the paradoxical nature of this transformed near-death experience should make them more godlike. And even God can't live with my wife. Come on.
Right.
And it was fascinating. And I think that what you said is fascinating in terms of the transformative, and it gets a little bit at the why. And maybe what I hear you saying, the why is kind of like your finger's hand, that we discover or think about for the first time, whoa, maybe there is something beyond ourselves. To me, having had a near-death experience, which you both know I've had at such a young age, having it at a young age set my sense of spirituality throughout my entire life, but it also taught me firsthand what those core features are and were, and I had every single one of them very clearly. But it was as if something was imparted onto me. It wasn't my sentience or my intellect saying, you know what, people are too mean to each other. I think that I'm going to be better. It's as if you returned to your source, and you had since forgotten when you left the source. And that's why we're all acting generally like jackasses nowadays.
Almost every near-death experience says something like, I didn't learn something new. I relearned something I had forgotten when I came here.
Right.
And like you said, it's not something that you figured out rationally. In the near-death experience, you don't have your rationality. You don't have the things that usually define you, your gender, your age, your political affiliation. Those are gone. And yet you feel better than ever without those things. So when you come back, it's hard to put those clothes back on again and act as if nothing happened.
Yeah, and the reentry process feels very much that way, as if you're slipping into heavy, wet clothes, and it's not comfortable. You don't want to be there. Having returned from a place of absolute joy, love, lack of pain, the ineffable. Everyone says it's ineffable, even if they don't know what the word ineffable means. It's uncanny how similar the experiences are. And Dr. Schulman and I have been talking about in a great anticipation of this show is, can we use our insights and the lessons and our knowledge of the transpersonal experience and this type of growth through the mechanism of a near-death experience to somehow extend it out in another way to the world? Because, like Rumsfeld said, we need a mass awakening. Oh, wait, I'm being told that he said we need another 9/11. Oh, no, Pearl Harbor. You're fired. Fire that person. But we're living awakening.
We're living in a mass trauma.
How can
and trauma creates interesting psychophysiological effects, and not only does it bring up everybody's trauma, and my experience with the patients with near-death stuff that was most impressive was when they came up with something that, you talked, before we started, we talked about, well, Brian Weiss wasn't looking for proof in reincarnation. I had some things happen where patients identified things and found out later that they looked them up or whatever, and they were true, and there was no way they could have known this. That was very impressive to me. The other one that was really impressive, I was working with the body therapist, and the patient goes limp. She's talking about a surgery. She goes limp, and I turned to the body therapist. Did she die in front of us? That's it. She looked dead. I said, we're never going to be able to explain this to anybody. And then she was just re-experiencing, and then she had a classic experience. She didn't want to come back. She had to come back for her kids. Came back. Her chronic pain that we were working on was significantly less. So yeah, it's a real effect, boy. And do you ever get frustrated that mental health practitioners are not taking, for the most part, are not taking this seriously?
Very briefly, but I quickly pull myself out of it because I was there once myself. So I understand their perspective. And I understand how frightening it can be to think that this physical world isn't all there is, because we can kind of control this world, and that feels safe. And if you're talking about some type of, spirituality, some type of spiritual that we can't understand, that's pretty scary for people who need to be in control.
Yeah, because it implies their own mortality.
And there's a lot of unknowns there as well. And if you're not comfortable with the unknown, if you don't trust that the universe is a friendly place, it's very scary not to be in control.
So how does an emotional shift, a psychic shift, however you want it, that big of a transformation occur? How is it that a out-of-body experience, let's say, or psychedelic experience. Matter of fact, ketamine, Dr. Carl Jansen had said it reproduced every aspect as described like in the core experience. So how is it, or do you get a similar and lasting transformative effect after all those experiences?
Great question. I mean, I don't think we have the total answer to that, but it's clearly an experiential thing, not a logical thing. You have to experience it. The question is whether you can have this without coming close to death. And there does seem to be some accumulating evidence now that you can. And you mentioned ketamine. There's a lot of research going on now with psilocybin, which is much easier to use. It's got a shorter duration of action and so forth. But some of the work they're doing at Johns Hopkins here in this country and at Imperial College in London are showing that with just 1 or 2 doses of psilocybin in a very controlled setting can produce long lasting psychospiritual effects up to a year or so after the event. Now, I want to just warn people who might be listening that you don't just take the tablet and then go off and have a trip. You're in a safe environment with this, soft lights and soft music and people there to guide you in case something doesn't go right. But that can really open you up. And if you experience it, it becomes hard to deny to yourself that this is really happening. I don't know whether the effects of a psychedelic trip will last for decades the way a near-death experience will. Part of the effect of an NDE, I think, is the lack of control and experiencing not being in control and thinking, yeah, I was better off like that, not trying to be in control of things. And if you're inducing the experience with drugs or with meditation or some other thing, you're not totally letting go of control. So that may work against you having the long-term after effects. I'm not sure about that. Now, there is some evidence that even just learning about near-death experiences can change you. And there have been a total of 5 studies now with college students, 1 nursing schools, and one high school class who are given courses in near-death experiences. And they measured their attitudes and altruistic behavior before the course, afterwards, and then 1 or 2 years later. And there was a significant change, people becoming more compassionate and more altruistic after learning about near-death experiences. Again, I don't know if that's going to last for decades, but it's hopeful.
Well, and that's critical what you just said, because that's, I think, the missing link to how to take such a rapid, powerful shift and apply it to the wounded people of humanity these days. I mean, I would have thought, some natural disaster happens on the earth in which we're not allowed to name, or from the skies or something like that, that we'd all pull really close together. We would rediscover that we're all connected, and didn't happen at all. It went the other way at the speed of the Big Bang. And so we're trying to craft a way to get out that type of experience, that type of information, maybe writing a book, like after, here it is on your bookshelves, stores, Amazon. We get off Amazon. A lot is in there as well. But how can we get this from bench to bedside, so to speak?
I think, again, the answer is through experience. I mentioned that the classes that were taught about near-death experiences, one of the most effective was taught by the late Chuck Flynn at Miami of Ohio University. And he had students not only read and talk about near-death experiences, but he gave them assignments to go out into the street and find a total stranger and do something to help that person, to get involved in that person's life and try to make it a better life. And they did that and had to talk about what they had done in class. And that had a profound effect on them, actually trying to be in someone else's skin and seeing what it's like for them and helping them out.
So that's kind of through education, through the university. I thought you were going to say something like, we've got to do a fake broadcast that the asteroids come into be
the world,
a planet killer, and we better shape up. Better get along. We're all connected. We're all in this together.
Right. Well, there is the hope that would bring us together, but as you as you know, that may or may not happen. It may also make us draw the wagons around in a circle and protect ourselves. So we need to get people to think in terms of the interconnection between people rather than the things that divide us from each other. Those things that divide us in a near-death experience, those are shown to be just illusionary. They're not real. And the only thing that's real is the part that connects us to each other. And that's hard
sounds almost
to
like we are reinventing Buddhism here.
Yeah, yeah.
You know, I studied with a Buddhist scholar for a couple of years, and he said almost exactly what you just said. You know, nothing's permanent, and you know, there's never one reason for anything, and we're all connected. So don't act like you're not. It was very interesting. You know, I want to change gears slightly. I'm interested in your thoughts on time and the near-death perception of time, because time is when I'm working with people, time in trance states is up for grabs. And I'd really like to hear your thoughts about it.
I don't understand time at all. You know, I know the time that we live in here, and I'm very aware, but I can tell time as well as anyone else can. And yet near-death experiences consistently say that time ceased to exist or it wasn't real in the other realm. And yet when they tell me what happened in the ND, they tell it as if it's a sequence of events. And how can you have a sequence without time passing? And when I ask them about that, they say, well, when I tell you about it here, it sounds like it's a paradox. But when I experienced it, it wasn't a paradox at all. Things were happening in sequence at the same time. And we don't have the language to talk about that. It doesn't make sense the way we conceptualize time. And they say it's like you stepped out of time to a higher dimension where you can see all of time the way you can see all of space. So I don't know whether time is just an illusion that we create for ourselves in this physical world, whether there is something else that we just don't understand that is really time.
In my experience of trauma, just hypnosis, there's a lot of time distortion effects, and the mystics talk about this for millennia. You know, life is a dream, or you know, I can't. If it is, it's pretty persistent. It's a pretty persistent dream. And that in my experience, I've never had a near-death experience, but I've had several out-of-body experiences and mystical experiences with that exact feeling that time didn't exist. And what I came back to was like quantum physics, they both have to exist. The linear and this, I don't know what to call it, this circular time, I'm not sure what to call it.
Well, it reminds me of like the Tesseract in Interstellar, you know, that there's this point in which all time and place exists, and I don't know, you can access it in that way. That makes some sense into understanding, I guess, the transformative, because that's so outside of your realm of understanding to be able to experience that, and no one can tell you didn't experience it or it was hallucination. So you're on your own with this, and you come back with this discovery, with this knowledge, with this rediscovery of the awareness, and you feel different. Something's changed in you. It's not like, you know, that was interesting, but I'm going to go back to being a stockbroker, or man, that was interesting, but I don't think I can quit my job. You know, it seems really powerful. It's not people change a little, it's a huge change, which is what causes people to notice the personality shifts, and always for the better, right?
Well, in certain perspectives, it's for the better. You know, if you've got the mindset of the achievement-oriented Western world, it's not very good. But in terms of a spiritual perspective, like a Buddhist perspective, that's where you should be. You know, you brought up an interesting point, though, and that is how you try to talk about these things to other people. And as you said, many people have difficulty with re-entry, coming back into a quote normal life. And I tried for a while using what I had learned as a psychotherapist to try to help these people. And it wasn't getting very far because I didn't really understand what they were telling me. So I started putting them together in a group for group therapy. And I found that it's even better when I step out of the room and just let them work with each other because they understand each other. They know what they're talking about. And if you get them all together in a room, some have advanced at different stages and they can help each other deal with how do you understand this? How do you get your family to live with it? How do you negotiate the physical world with this information? And, as you said, they all come back with the same knowledge, the same understanding of the way the universe works, and they can be of great help to each other.
I think you just answered Mark's question about how to bring this to a larger audience. It's grassroots. You work with one person in a group, they talk to their family differently. I don't know that we're going to do this by, sort of getting on Facebook or something and shouting it. But when people that you trust and love experience this, it's hard to dismiss.
Rich, it's interesting that bringing it to the general public through Facebook and whatever else has had some effect. Let me explain what I mean by that. Because when we started doing this work 40 years ago, no one had ever heard about these things. And we talked about people this in medical conferences, and they just sort of sit there silently, like saying, "What are you talking about?" And now, when we talk in medical conferences, doctors stand up in the audience and say, "Let me tell you about my experience."
That's cool.
So it's and I mean, everyone. Homer Simpson's had an NDE. Everyone's had one now.
Yeah.
And what that's done is it's encouraged people who've had the experience to talk about their own experience and to share it with other people. And if it's that common in our society, a society as anti-spiritual as our society seems to be, then it becomes safer for people to talk about it and to explain to other people how they've changed and to show people how they've changed.
Yeah, I guess I was being a little narrow there, but it is about people telling other people, and I would dare say that people trust you, that you're bringing the information and you're a reasonable person. And, I was thinking about this earlier. I bet this threatened your career at certain junctures. Because I know when I started getting into metaphysical stuff, they would say, "Don't say that out loud, you're going to lose your job." And now I'm in private practice, so they'll let, my patients can fire me if they like. But did it affect your career?
It did. When I was starting out, if people would learn that I was interested in this stuff, they would kind of dismiss what I was doing and think, this guy's a lunatic. He's not going to really make it. It's as a scientist, as a doctor. And now, I've countered that by publishing my work on near-death experiences in major mainstream medical journals, where it's gone through extensive peer review and been, validated by the establishment. And now that I'm on the other end of my career, people no longer dismiss me like that. They dismiss me by saying, "Well, now he's getting senile. He doesn't really." But there are enough other people like me of the next generation, of the next two generations now, that are coming along and taking these things seriously. We tend to not realize how widespread these beliefs are among scientists and among healthcare professionals. But there have been now 3 studies done of scientists' attitudes towards the mind-brain issue, one in Scotland, one in Belgium, one in Brazil. And what they've consistently found is that about 50% of scientists generally and of neuroscientists believe that the mind and the brain are not the same thing. That although they seem to be working the same thing in everyday life, under extreme circumstances like near-death experiences and others as well, they can function separately.
Do you find that you're received differently in different parts of the world?
Yes, I do. When I talk to audiences in the United States, particularly medical audiences, I have to start by explaining what a near-death experience is. And I had the opportunity about 10 years ago to talk at Dharamsala, at the Dalai Lama's compound, to a group of monks and Western scientists dialoguing about the mind-brain issue. And what I found was that nothing I said was new to them. The monks knew, they grew up with this stuff, they know all about it. What surprised them was that a Western scientist was taking it seriously. But they know all about this stuff.
Right. Yeah, that was my experience with my Buddhist teacher, that, you know, because I thought I was presenting him with some really cool stuff. And he goes, yeah, that's right.
One of the themes that we have on the show, it's probably about half of all of the episodes we've recorded, is called the non-ordinary mind. But basically it has to do with consciousness and all of its form. And related to this, raising consciousness and awareness, whether that's through education or all, you know, them poisoning the water supply so we can all undergo our own near-death experience, but that doesn't seem very practical. Wouldn't be good for humanity. How in the world can you get that message? Like, could Netflix tell a story about a couple people that went through it and had these amazing changes? I don't think so. I mean, it would be great. Wow. Oh, wow. During that hour, then you turn off and you go beat your kids and drink your vodka and say how much you hate your job.
Right. Seeing it on Netflix isn't going to change your life, but hearing it from your spouse or from your parent or from your child may. And what the Netflix series can do is encourage those family members to go out public with it and to share it with you. But I think it's the intents, as Richard said, that, you know, the one-to-one connections that are going to really make a difference.
Yeah.
Wow. Okay. So 1-to-1, is that like with patients on 1-to-1? Challenging their beliefs, exploring their religion, asking if they've ever had a near-death experience.
Right. Not necessarily challenging anything, but just asking them to invite them to reconsider what they thought they believed and to see if there's another way of looking at it.
Yeah. And just even asking them about spiritual experiences or non-ordinary experiences, I think a lot of therapists don't even consider it. They may ask about trauma, and I found almost invariably dealing with addiction, I'm going to deal with trauma. Dealing with trauma, I'm going to deal with some kind of non-ordinary experience. It's just the nature of the beast. I remember reading that ancient tribes would pick their medicine people from children that almost died when they were between 9 and 11, figuring they knew the way to the other side. It made a lot of sense to me.
Certainly some addiction is people not trying to get intoxicated or getting, not trying to escape this world, but trying to achieve this other altered state.
Absolutely, yes. I mean, if you talk to heroin addicts, as I have had the opportunity to do, you ask them, what was that first shot like? They almost invariably talk about a feeling of God, of complete peace, you know? And then they spend the rest of their lives trying to find that again. Of course, the brain doesn't allow for that, but it's what people are looking for.
What Alan Watts said about substance abuse is that once you get the message, you hang up the phone.
I love it.
That's actually really deep.
Wow. Certainly.
Or it's like jumping on a trampoline and each time thinking you're going to get a new vantage point at the top.
Right.
What's been the most memorable, the most, I guess, shifting of your own beliefs, attitudes, understanding? What interaction have you had in your career where it was probably the biggest, best example of how someone else's near-death experience could actually help you, train you, teach you, heal you, without it being a shared death experience?
Yeah. No, I haven't had anything like a shared death experience. And I mean, there have been a lot of stories I've heard from near-death experiences that are just totally mind-blowing on an intellectual level, like people who encountered deceased loved ones that no one knew had died yet.
Wow.
and the near-death experience just encounters them, and then later everyone else finds out, oh, this person died a few hours before you had your NDE. But those are as affecting to me in an emotional way as seeing people change over time as a result of their experience and hearing their explanation for it. Let me give you one example. A guy named Tom Sawyer, that was his real name. He was the class clown. He bragged about never reading a book after he finished high school. He was a laborer. And one day in his 30s, he was working underneath his truck, which was jacked up in his driveway. And the truck fell down and crashed on his chest and crushed his chest. And he had a very elaborate near-death experience. And part of that included a very detailed life review in which he went through every event of his entire life. This is in a matter of minutes. But he experienced it not only through his own eyes, but through the eyes of other people involved. And this included things that happened to him when he was an infant, where he saw things through his mother's eyes, through other relatives' eyes. But the one that struck me most was he remembered being a teenager driving his truck down the street, and a drunk man ran out in front of him. And he jammed on his brakes and almost hit the guy, but didn't. But he was furious because this was a hot-headed teenager driving down the street. So he rolled the window down and started yelling at the man. And the man, being intoxicated, reached his hand in the car window and slapped Tom across the face. Well, you don't do that to a hot-headed teenager. He got out of the truck and started beating the man up and left him a bloody pulp in the median strip, and then calmly got back in his truck and drove off. Well, when he had his near-death experience, he relived that not only through his own eyes, feeling the rage and the adrenaline rush, but also through the eyes of the drunk man, feeling the humiliation of being beaten up by this kid, feeling the 32 blows of Tom's fists on his face. Now, Tom couldn't have told you there were 32 until he experienced it from that man's perspective. Feeling his nose getting bloody, feeling his teeth going through his lower lip, feeling all these things simultaneously from Tom's perspective and from the other man's. And he came back from the NDE thinking, there's no difference. I am him, he is me. And he lived that then. And you could see in the way he treated other people. He just couldn't think about being harmful to another person, thinking negative thoughts about another person. Now, of course, you're human, you do these things, and you should immediately say to yourself, no, of course not. But he treated people differently. And I knew his family as well. Got to know his wife and his kids also. And his wife said, it's a mixed blessing. Because on the one hand, we desperately need a new car. And he couldn't care less about those things. Physical objects mean nothing to him. So it's really been a struggle. On the other hand, he hasn't beaten me once since his NDE. So, they take it with the positive and the negative.
Sounds like that really touched you in a way, because and I know that some of the experiences I've had with this, just they really my background is a little bit different from yours in that my father was a science teacher. But my parents talked about ghosts, that, oh, your grandmother turned on all the lights in the house while we were gone, or kind of thing. So I wasn't that far removed from it, but seeing it in real time in people and then having like out of body experiences myself, it changed me. I was brought up in the psychotherapy world, cognitive behavioral, and then I just it didn't match my reality. And, having these kinds of experiences changes you. You can't help it. And I think witnessing them, talking to people who have no reason to make this up. Quite the reverse, as a matter of fact.
Exactly. Yeah. One of the most consistent things you hear from near-death experiencers after the event is that they're no longer afraid of dying. No matter how they describe the NDE, they are kind of looking forward to going back to that realm.
Yeah, I would agree with that for me.
Yeah. Well, when I first heard this as a young psychiatrist starting out, I was afraid that if we publicized that would make people suicidal. Because I'd worked with people who were thinking about taking their lives, but were hesitating because they were afraid something might happen to them unpleasantly if they did that. So I did a study of people who were admitted to my hospital with a suicide attempt and compared those who had a near-death experience as a result of the suicide attempt and those who didn't. And what I found, to my surprise, is that those who had a near-death experience were much less suicidal after the NDE. And that was counterintuitive to me. So I said to them, explain to me why that is. And they said that I still got the same problems that made me want to take my life before, but now I see them all in a different perspective. Now I see there's meaning and purpose in everything that happens here. And that what I used to feel I need to run away from, now I feel I need to learn from and grow from. And that when you lose your fear of death, you also lose your fear of life. You're not afraid of dying, so you're not afraid of taking chances, of living fully in the moment and getting all there is here. And that makes life much more enjoyable for them.
Yeah, it's always going to be about meaning. I mean, it's my impression, not just from my experience, but from talking to you today, it's like a really compressed psycho-spiritual psychotherapy experience. 5 seconds, okay, next.
One of the first NDEs that I heard personally was a psychiatrist in Charlottesville, here in Charlottesville, named George Ritchie, who was also the first NDE that Raymond Moody heard, because he used to talk about his experience back in the 60s when no one else was talking about them. And he said it was like, my NDE was like having 10 years of psychotherapy in the flash of an eye.
Mm-hmm.
And he actually had 2 near-death experiences. So I asked him, why do you think you had 2? And he said, well, I guess I needed 20 years of psychotherapy.
That's good. That's really good. Lots of psychotherapy.
Well,
And getting back to, I actually have a question. Okay, what's next? I mean, is this it? What do you think is next? You put on your crystal ball hat, and I don't know if that's right. Look at your crystal ball and put on the purple hat. What comes next? What do we look at?
Well, I think that what you and Mark were talking about before about bringing this to the world is where we need to go with this, and find some way of spreading the word about this and making it acceptable for people to live a more spiritual life. And that's more than just a cognitive shift, because our culture does so much to encourage competition and getting ahead of someone else's expense, and that seems so counterproductive from a spiritual perspective. So we need to somehow make that shift in the culture.
Yeah, it kind of bothers me when billionaires say we're all in this together. That I mean, that's what we've been getting a lot of. We're all in this together, except for you people who don't agree with me. And that's the cultural divide Mark was talking about earlier.
Well, Bruce, what specific modalities or things would, in your mind, would be worth exploring, learning more about, deploying? If anything, for example, are we talking about, handing out flyers like Jehovah's Witness, knocking on doors, or putting it under people's, or a Hollywood movie that really deals with this? What the bleep do we know? There have been some historical attempts to do it, versus encouraging people to do service and see if that part of them they will get in touch with and resonate and stop being such a hellraiser. We're trying to figure out what's the fastest, easiest, best, and most successful approach to get people to realize, to discover we're all one, we're all connected. And if you do something naughty, you're going to pay for it in your life review, and it's going to feel exactly like what it felt to the person that you hurt them.
I don't think you can tell somebody about that and have them do it. People have been, churches have been telling people that for centuries, and hasn't made much of a difference. I think you have to experience it. The quickest way is by having a near-death experience.
Mm-hmm.
But not everyone has one. Not everyone who comes close to death has one. And in fact,
Flatliners.
Pardon?
What we could do like a flatliners.
Well, I don't know if that's going to work.
Just get a couple thousand volunteers in a stadium and we just knock them all out and hope they all come back.
I don't think my hospital's institutional review board would let me do that. But religions for centuries have been developing technologies to reproduce these things, and they're not quick fixes. There are meditative things. They're using psychedelic drugs and different substances, movements, twirling around, drumming, ways of inducing altered states, and then with the help of a guide or a guru, processing those altered states and understanding what they're about. And as I said, it's not a quick process. It takes a long time, and some people may take decades. You mentioned, Mark, having people do service. I think that's a very effective way of getting people to change their lives, having them act as if they are altruistic. And when they do that, they become more altruistic. They see what it feels like, and that changes them.
And then they'll experience the feeling of the person that they helped at the pearly gates, or I'm going to go with Bardo plane. I don't know what the kids are calling it nowadays, but I hear it's lovely. No, it was very interesting, and there are a lot of the features. I wanted to talk a little bit more about specific core features, because all this sounds so fantastical, and my left brain early in life would not have believed any of this. But then one day I fall on my head. Actually, I was pushed out of a big banyan tree. And what shocked me is I have a vivid recollection of before I hit the ground, right? Leaving my body. So my body left. I'm sorry, my body kept continuing on to the banyan root, I guess, that was sticking up above the grass, which my head would later find. But my astral body, or my awareness, my sentience, immediately stood behind my mom, who was looking out on the phone, looking out at the tree that I was climbing. So she literally saw me fall. But the creepy part about it is I saw her see me fall before I hit the ground. What does that tell us about consciousness and the way that we're all put together, and how we're connected, and how thought takes us to places, and how our mind can literally give birth to reality, manifest reality.
Talk about the situations in which the mind separates from the brain, and we usually go towards situations in which the brain is compromised seriously, whether it's for some cardiac arrest or deep anesthesia, or something where the brain is really shutting down and the mind seems to be working full force. In fact, better than when it's trapped in the brain. But as you were saying, when you were falling out of the tree, your brain wasn't compromised at the time you left your body, before anything physiological happened. And that's actually a common experience. It's a psychologically protective experience. You perceive that your body is going to be traumatized, so you don't want to be there, so you leave. And I'm sure, as Richard knows, people who are being traumatized, for example, people who are being raped, will often leave their bodies as a way of avoiding being in this situation.
Part of my interview is, are you recalling this as if you're inside your body, you're watching a video, and that tells me where they were?
Yeah. So I think what it tells us is that the mind and the brain are not the same things, and that the connection between them is under some type of voluntary control. I mean, you don't need to have the brain demobilized to be able to leave it. You can leave it without that.
Something occurred to me recently. I was treating a man. He recently died a couple of weeks ago, and he was very afraid of death. And we worked on it for quite some time, because when I met him, he was 88 years old. And I talked to him about all kinds of things. And maybe about 2 or 3 months ago, he started asking me, he said, you think this reincarnation thing is real? I said, I guess we're getting close to the end zone here. It was interesting because I visited him the night before he died, and I had to say goodbye, and I gave him a kiss, and said, I'll see you on the other side, you old rascal. But it was very interesting. His son told me about 3 days before he died, he completely lost his fear of death. And he said, well, there's people on the roof. My friends are on the roof. He was obviously, in my world, he's seeing into that other world. And I saw this with my mom as well, lost the fear of death a few days before. I don't know if that's part of what you study, but is that something that you see also?
It is, yeah, yeah. These experiences that occur around the death as people are making the transition, they will often straddle both worlds, leave and then come back, and leave and then come back, and that changes them, and it makes them much more comfortable with the death process.
I think it actually changed everyone around him too, because to me, he didn't have to convince, but his family was around seeing this transformation. I think the fact that they were with him, he was at hospice at home, the fact that they were with him around that time, especially his son, who held him as he died, I think was a transformational experience for everybody involved.
It's a wonderful gift for the person who was dying, but also for the family to see that they're dying in peace and no longer frightened.
The funny thing is, and this is just, grist for the mill, I was walking the next morning and I said to my girlfriend, he's gone. 30 seconds later, I got a text from his son, Pop passed. It was uncanny. And she had predicted he's going to say goodbye to you on the way out, which I thought was beautiful, actually. Wow, we sure have covered a lot of ground today. My goodness.
Yeah, and I want to have this, like, maybe we could have you back for part 2 next year or something, because
sure.
There's so much here that could help so many people. I love talking about it. I think we all love talking about it. But one of the things that makes you unique and that I've admired is, much like even Stevenson, not really giving a crap what anyone thought. You're sort of following in his footsteps in that regard, while operating in a state institution, a university. That's difficult, but you also have brought what I wanted to bring to the field, and that's that left brain scientific approach first, but then having an open mind to extrapolate what this could mean. A good question that gets answered often introduces many more good questions. And so I think we're getting closer and closer. If we could share this with humanity and impart that knowingness that we're all connected, and that by hurting me, you're only hurting yourself. Boy, I think that's the world that we would want to live in. And probably we could start hitting hunger and climate change and all that stuff.
As a person who's been accused of not having a left brain, I admire your courage.
How'd you know I was born without a left brain?
I don't know if I was or I wasn't, but people have accused, you don't really have a left brain, do you? I really admire your courage in being open with this, because people, it's just courageous to put yourself out like that for the truth. I am impressed.
I'm blessed by being able to work in clinical situations. And one of the ways in which clinicians differ from basic neuroscientists is that they're more concerned with the practical value to patients than they are to the theory of what's going on. And if you can convince doctors and nurses that these are important experiences they need to know about, then they want to know about them. They don't care if they can understand them. They want to know if they can use this information to help their patients.
When I started doing mind-body stuff, the medical director of the hospital came up to me and went, "You and that therapist are doing voodoo on the patients." I said, "Wait a minute." And he goes, "I don't want to know. They're really getting better." Mm-hmm. And as long as I think my Buddhist friend basically said, we're here to help relieve suffering. Forget about theories. He said to me, anything doesn't fit your experience of life, throw it away. We're here to relieve suffering, and that's what you're bringing. I think it's beautiful.
Well, I like that. I'm going to continue to use that in my own private practice, but we're about out of time. Boo-hoo. I might have a longer slot or a lot less questions. How about that?
Thank you
I'll
so
try
much
to get the best.
Thank you so much for being with us today. I really, really appreciate your time.
I appreciate it so much, and everything that you did back for me in Virginia and all throughout my career. I was reading your books, and it helped shape me in many ways to who I am and why I am. So I appreciate it, Dr. Greyson. And then join us next week because we're going to be talking about placebo. But don't forget, order Dr. Greyson's book called After. Sorry, we don't have a special effects department.
No, that is the special effects department.
I could do it right to left too. Again, thanks, Rich, Dr. Greyson. It's been an honor, and we shall see you in 2022. Sound like a deal?
Everybody buy the book. It's good.
Maybe if everyone read this book, that would be the change that we're looking for. That would be the mass awakening. Let's promote this book out the wazoo.
There you go. Mark
Right.
as ad agency.
Thank you.
Just let me know what you need me to do. I'll start tucking them under windshields. All right. We'll see you next time.
Good to talk to you.
Bye-bye now.
Bye.
Thank you. And until then, remember,
Be well.
be well. Bye now.
Bye now.